So, hi, I'm Dionne Wilson, and I started here in 2006. Prior to coming here, I worked in sports medicine for about 10 years. I really just wanted something that looked at a more holistic approach and treating a whole individual versus, a specific body part. That works for a lot of people that are just post-op, repetitive injuries, short-term, acute kind of injuries. But I saw a specific patient population that were more chronic patients, and the general sports medicine method just didn't help alleviate their pain and help them return to the activities that they are wanting to get back to and function at their top level. So that's why in 2006 I came to a chronic pain facility, and I've been here since.
My name's Kelli Gonzalez. I've been doing physical therapy for a number of years now. We won't say exactly how many. I've a variety of experiences and facilities I've worked at. Like I said, I've done acute care, skilled nursing. I even did rehab. Moved here with my husband and decided to give chronic pain a try. And I've been here, we started 1 week apart, so I've been here almost 18 years. So I love looking at patients, looking at them holistically, kind of assessing everything we need to take a look at and developing a program to help them be the best version of themselves.
I think the piece of the chronic pain facility that I like the best is we have a very close relationship with our referring providers and with our patient population and individuals who are having these chronic pain issues. That is invaluable because we bounce so much back and forth. If there's extra issues, we can communicate. If they want something specific from us, they're office space away. And I feel like that is key to helping these individuals reach their max potential, is just that collaboration back and forth, which is a lot harder in several other settings.
Mm-hmm. Yep, it's nice to have them close. Like I said, it can be something as small as there's something missing in the chart that we need for you to add back in. Is it a medication issue that we need to get back to the doctor about? But it's nice having them around the corner just to kind of bounce things off of them.
And I think another thing that helps the providers with their care is we do have 45 to 60 minutes just one-on-one treatment with each patient. And that's pretty unheard of nowadays with physical therapy. A lot of times it's 30 minutes or there's multiple patients at a time. And the other key is that you are with us from the first day into the last. And so we can assess little changes a little bit better because you're not seeing several different physical therapists who maybe aren't picking up on these things. And I feel like that's another important part to be able to communicate back with the providers. And people do have really easy access to us when it's sometimes harder because of larger patient loads for the providers. So they know they can come to us and have questions, and we will communicate those questions with their referring providers, and a lot of times can get them a good answer fairly quickly.
Yeah, bouncing off that, I think it's really important to have that one-on-one time with the patients, and they kind of develop a rapport and a trust with us. So it gives us that full amount of time to kind of delve into whatever's going on. And like Dionne said, if there's any issues, we can kind of talk to the doctors about it. But I think just having that one-on-one time with them is very important with a chronic pain patient.
And I think along with all of that, the extra time we get, the 45, 60 minutes, we are really able to look at a more holistic approach. So your chief complaint might be neck pain, it might be back pain, but there are so many times where that is just the most significant symptom. But there's contributing factors. There could even potentially be a factor that's creating that may not necessarily show itself immediately until after you kind of dive a little bit more. So that's kind of why it's nice to have that extra time to be able to really look at a whole person and see what all might be contributing so that we can address it a little bit better.
Yeah, it allows us to get to know them to be able to help them.
And in our field, a lot of times just that one-on-one, we sit there and listen because that is what a patient needs. They need to feel like they're being heard and that all of their complaints are being heard and that there's someone that really wants to help them and is going to kind of walk along with them to accomplish that.
Yeah, it also gets us to know them kind of on a personal level too, and I think that makes them feel more comfortable.
And comfort is key in physical therapy and chronic pain because we have so many people when the doctors recommend, okay, we want you to see our therapist, and they're just really reluctant because they tried PT before and they know that it's hurt and it makes them worse, and then they can't do things that they can typically do. And so getting that trust in them and getting them to understand that we are not here to create more pain. We're going to listen to you and work with you to do what you can do without increasing your symptoms.
I think a lot of time they've had bad experiences, more of it an outpatient PT type setting where they don't really focus on the chronic pain aspect. They're more into pushing the patient. So I think a lot of our patients come to us having that experience. So they're very reluctant to try PT, but in the chronic pain setting, we try to help put them at ease and make them more comfortable and get them to be able to do things without pain, so they know that they're capable and they can succeed at it.
And I think that learning that you can do things without pain is that whole pain neuroscience education part of it. And education is probably one of the top things that we do for our patients, teaching them about their pain and how they can live without pain and how they can move without pain and how to adapt things so that they can accomplish those kind of activities too. All of the education part. So yes, we do an objective exam and subjective, and we look at range of motion and strength and do neuroscreens, but really kind of teaching them how their body has the bioplasticity and can change, and they don't have to live the way that they lived is key. So I think in addition to the collaboration between the PTs and our referring providers is the collaboration that we have within the PTs. We have, we work with I work with Kelli, and I've been again with her 18 years. And so a lot of times there are complex cases where, we may need to bounce ideas off of each other, or we're kind of stuck at a certain point and people are not progressing. And, it's nice to have that PT or multiple PTs that you can work with to kind of bounce those ideas off and see, what experience have you had? Have you had patients with similar experiences, and what worked for them, what didn't work for them? And that's a real benefit too.
I agree. We work well together. We've been doing it a long time, and I'm not great with technology always, so sometimes she has to help me out with the technology, and I adore her for that. So.
The other good thing is even the PTs that aren't on site, we do have monthly meetings, so it's nice because we can, share experiences and what we've learned and new techniques or new information out that, someone's gone to a course and may be beneficial for everybody. So we have that monthly meeting set up to where we can kind of bounce those ideas and experiences off of each other, which is beneficial too.
Yeah. Addressing from earlier, I think a lot of patients aren't real happy in coming to therapy, so it takes a lot. I think it's that getting them to trust us. We just kind of let them know this is going to be a different experience. We are going to look at you a little bit holistically and get you to do things and that don't increase your pain. Therefore, that'll help you reinforce that positive, oh, I can do this, and that's going to help them succeed and want to do more. It's just, basically reinforcing that every time they come in, so they want to succeed. I've had a couple patients I know that, one I had just even today, she had been hospitalized for several months and just was having horrific back pain and limited mobility. And again, she was very frightened when she came here. She moved from out of state. So just giving her some heat and massage and modality just to kind of help her feel relaxed. She came a long way and was actually very surprised. She was able to kind of get up and walk again and move around, and she was very appreciative. So I love doing stories and helping people like that.
I think I've had several patients over the years that have gotten significantly better. Honestly, in chronic pain, it's not often that we have a patient that comes in, has had pain for decades, and after physical therapy is completely pain-free, doing everything they want. But there are a handful that will happen, and I think those are probably the most rewarding because once you accept that this is probably a part of your life, if that goes away, it's such a great experience for a patient and so unexpected, but so rewarding and at the same time. But in general, I think most of our patients are more of a they're able to walk their dog without pain, and they're able to play with their grandkids on the ground. They're able to do little functional things that they weren't able to do, and those are huge successes for them, even though they're not necessarily I can live pain-free. And I think in this setting, that's more of what we get, and equally rewarding for them in a lot of ways.
Yeah. I just had a patient this morning telling me she was able to go out to lunch with her sister, and she hadn't been able to do that in a long time because the therapy has helped her, and when she leaves here, she feels so much better. She goes, I can go out and I can be active. So I like that.
And I also think the patients, there's been so many patients that have come in here and have really struggled with getting out of their house and socializing. They've got a lot of depression and inactivity, and when they come in and say, just coming in here, I do still have pain, but I am more active. My whole outlook on life is better, and I think that is the most rewarding. We can't take people's pain away completely the majority of the time, but if you're improving someone's quality of life, I think that is, a win. Mm-hmm. We do have PT here in Indianapolis, and honestly around the Indianapolis area, Avon, Greenwood. We have locations in Ohio at Integrated Pain Solutions, but we're located in several different locations around Indiana and Ohio. So we treat fibromyalgia and spinal pain. We treat joint pain, pretty much any chronic pain, multiple sclerosis, just anything typically over a few months, and we treat it. We have openings, and if you need some chronic pain taken care of and want to come in and see us, then give us a call.
We're here to help.